soifua ma ia manuia.
Whaftai lau ki onga ui whatali mo le saunoanga matangofia i le nei tai au. Ia ua whafonga i foile malu o le tātou fia ma la tunu ua whatasi mai le nei whasala launga. Mo le atu foile ngang whaftai i lau fionga i le Kovansili, lau fionga le manu. Ia ona o le tanoa, ia ma le lau malenga foile nei tai au le ua. Whafonga le atunu ma o te talitonu ua malia foi fina ngalo i tūlanga o le tātou whaamoe moe, whaftai te le atu. O le teimile nei, o le amatalia aloa ia le tātou whaatala noanga, ia o le tātou media, o le press conference le ua amata, le weekly press conference of the EOC and the COVID task force. Whaatalofa atuai le mamalu o le atunu u mawhai o na maua le nei whasa launga o tōpa ia ma mamalu o le a o le toe o iai a wao sā mawhai ngatā i mai le vavau e o lava i le whavavau. Tau ia no o tulou na lava. Whaatalofa atu i le maleifua mai o le mamalu o le tātou atunu i le nei tai au fou. O iai foi le manatu i le tātou komiti ia ua tatau o na mātou o mai. Ia e matu atu foi se whamatalanga ia awa ia fuafuanga le tātou mālo a wale nei whaamai watu o mai lo tātou atunuu. O le nā ua whaafonga le atunuu i le saunoanga le fionga le kovana ua whaawawina le tātou Code Red i le tasi vai aso whaumalina i le aso sifulu malilima o mati. Ia o la sos fulma lima o mati, o leo wha wairitato Code Red, South Temi, ia ona sauno ato leo la fionga le loia sili, i suinga o le a iaile tato Code Red e ana iluma, a matalia le le aso atayao. I'd like to say hello and greetings to all of American Samoa who are attending this press conference. This is our weekly press conference call to give the media and the people of American Samoa an opportunity to hear from our doctors and our frontliners as to how we are proceeding with our COVID response. As you all know, we are in the early stages. We are in the early stages of a surge of community spread. And so we are working diligently to try to keep it in control. Welcome you all. We look forward to hearing your questions. Today's press conference will proceed with first with the report from our Department of Health to explain their work. And then the LBJ, our hospital, will have an opportunity to talk about what's happening at LBJ and the number of patients who have come in with symptoms. Third, the Attorney General Utu will speak on the issue of Code Red and some of the changes that we will hope to finalize by the end of the day today and document it for everyone to see. And finally, as you all know, our federal partners are here, FEMA and our federal partners from HHS arrived last Friday with our Congresswoman Uifatali. And so they are going to be released today from quarantine and will be available to start the much needed work that they will do to help us. And we will give them an opportunity to say a few words and answer questions of the public. So with that, I will turn over the mic to the Department of Health to start your presentation, and we will proceed from there. Tight.
Ya, watu. Tonu maununga mapuntu ele nei tayao tu sa pui malenga na yoma. Pau sa nolo yoma. No pau nolo pa foi de yoma ele. Pule, sitone. Palo tato task force. Ola na suba yoma ele. Ya, al nei tayao na usando o snapshot of our program. Via our media. Good morning, everybody. POH reporting from the headquarters in Tafuna. Dr. Ifili and Dr. Lawal will report on last week's productivity in regards to testing and also vaccination. Then we'll turn over to Dr. Fiona to address our flight coming on the 10th of March. So without further ado, I will turn over to Dr. Lawal and also Dr. Ifili. Over.
Good morning, everyone. This is a quick, most updated update regarding our COVID-19 outbreak here in the territory. Next slide, please. These numbers here reflect the number of cases that we've seen yesterday. Remember, the Department of Health did not open its community COVID-19 clinics, so there were no testing out at the sites. However, testing was still going on in LBJ. 77 were swabbed there, and 12 new positive cases were identified. Next slide. So that brings our total number of cases to 243 here locally. Of the 12 cases that we identified yesterday, 4 were treated. And that brings up the number of total individuals that have been treated to 34. So I urge the community, remember that the way for us to move forward and to beat this, if you're symptomatic, we're urging you to come out to one of our COVID-19 clinics. There's one in Leone Community Health Center, one here at Tafuna Health Center, and one at Amauli Health Center. There you can come in, get tested. We have physicians that will do an assessment to see if you fit the criteria for treatment, and then we'll get you treated. There are currently no deaths here in American Samoa due to COVID-19. I'll allow LBJ to do further updates regarding deaths and also hospitalizations. But yesterday, there were no new hospitalizations. However, there are 4 currently at LBJ at the moment, with 3 other hospitalizations that were because of reasons other than COVID-19. So total number of hospitalizations that we are tracking is 7. The 3 that we're talking about here have since been discharged, but there are currently 4 that are inside the LBJ COVID-19 ward. LBJ will further brief on those 4 cases. Next slide. We are also tracking the vaccination status of everybody that's tested positive. The 12 new cases that were positive yesterday, all were fully vaccinated. But if you look at the cumulative of the 243 people that tested positive, 202 are fully vaccinated, or about 83.1%. And that's pretty much aligned with what we're seeing with our total coverage of vaccination here in American Samoa. 5 people had only 1 dose, still awaiting that 2nd dose. 22 of them were unvaccinated, about 9.1% of the population. And among those who are less than 5 years old and are not eligible for the vaccine yet, there are 14. We're also tracking booster status of positive cases. Of the 243 cases that we have so far, only 36 have been boosted. I also wanted to mention that although we're tracking 243, that's the number of cases that we have documented. It does not necessarily mean that we have only 243 cases in the territory. We suspect that because the COVID-19, the virus that causes COVID-19, if you are to get the virus, a lot of people will probably feel very mild to no symptoms at all. And so it's possible that you have the virus but have not had any symptoms enough for you to come in. But we're urging the public to please, one of the ways, like I said, one of the ways that we're going to fight this and beat this is if you are symptomatic, we're urging you to come to one of our clinics, get tested so we can assess you for treatment. Next slide. This is the current situation here in American Samoa. This is our map of Tutuila. Currently, we're not seeing any cases in the islands of Manua, and also no cases in the island of Oahu. Right now, Majority of the cases are concentrated in the central and the Midwest part of the islands, where majority of the populations live. There have been some cases reported on the far east side of the island or the right side of the map, and one case on the left side or far west side of the island in the village of Wailolo. No other cases have been reported there. Next slide. This here is the count of cases per day. And if you look at how it's progressing, it looks like we're in a current surge right now as the number of cases continue to increase. The two far right bars for the 5th of March and the 6th of March, the Department of Health did not open our COVID-19 clinics. So those two numbers there does not reflect that the number of cases are coming down. It's just that the access point to getting tested was not the same as the previous days, but the days of the 4th of March, the 2nd of March, and even the 28th, that's when our our COVID-19 community clinics were open, and we can clearly see there that we are currently in a surge. We have an increased number of cases, and once again, I urge you, if you are symptomatic, please come in, get tested, and assessed for treatment. Next slide. We're also tracking the virus by age group, and if you see there, majority of the cases there are between the ages of 5 and 60 years old. We're also concerned that we have some young kids that are ineligible for the vaccine right now. We have a good group of our EpiNet team here in the Department of Health that are making calls every morning to all the cases to assess to see how you are doing. And if they think that you need to come in for treatment, we will arrange a vehicle to come over and pick them up. Okay, next slide. Sorry, this is not one of our slides. That's your slide. Okay. Okay, at this time, that's it for the update on my side. I'll hand it over to Dr. Laval for her portion. Thank you.
Those are the slides for the testing and a monoclonal therapeutics treatment. So we have all 3 sites open today from Mondays to Fridays, Leone, Amauli, and Takun at ACF. So those sites will be open for testing from Monday to Fridays from 8 to 4. And also those sites will assess patients to see if they require treatment. If they require treatment, the treatment will also be given at these sites, but only Amauli and Takuna they're given the IV therapeutics, but the other 2 sites like Leone and Leone only has oral antivirals, but no IV therapeutics. So if there's a case at Leone that needs to be treated with IV therapeutics, they will be transferred to Takuna, where the patient will assess and to see if they require IV therapeutics. There's also a plan to move forward to see if we're going to open ACF 1 on Saturdays for treatment, and also moving forward, we're looking to extend our hours of operation from Mondays to Fridays from 8 a.m. to 8 p.m. Thank you.
Next slide. All right, next slide. This is our test inventory. I won't go through this. Go ahead and go to the next slide. Actually, I won't go through our inventory. Next slide. Vaccination. Once again, one of the ways that we're really going to beat this is also by doing vaccination. Data suggests that if you are fully vaccinated and have also been boosted, it really reduces your risk of hospitalization and death. So please, we urge you to, 1, if you're symptomatic, come out to get tested, get assessed for treatment, and 2, if you are due for that booster shot, come out to our sites and get boosted. And also, if you have not received that first shot, or you've had your first shot, but you still needed to get the second shot, now is the time to come out and get tested. To get protected and get vaccinated. This past weekend, we had our drive-through operation at the airport, and it was a really good turnout. 1,569 individuals got their vaccination shots. I want to thank the community, thank those who are coming out and doing your part in really protecting our island. Get yourself protected and get vaccinated. Among the 1,569, overwhelming majority were for the booster shot. 1,286 came out to get their booster shots. Next slide. All right, currently right now, this is our booster coverage. If you look here, 11,427 among those who are eligible for the booster. That's the number that we have right now, or about just under 30% of the eligible population have had their booster shot. So if you look there, there's still about close to 20,000 of those who are now due for the booster and need to come in and get their boosters. 19,621 is what we're estimating. So there's a lot of work ahead of us. There's also quite a few, close to 6,000 individuals who are now fully vaccinated, but are waiting for that 5-month period after the second shot to be eligible for the boosters. Remember, after that second shot, you have to wait 5 months, and then you'll be eligible for the booster. And the reason why you're waiting for that 5 months is that because that second shot will give you good protection, and then when the 5th month comes up, we will give you a booster so that protection continues on for you. Next slide. 42,419. That is the total number of individuals here in American Samoa who've had at least one shot. And of that number, 40,136 are currently fully vaccinated. That's about 88.8% of the eligible population. But however, we're looking here at that number of past due for the second shot, meaning that after the second shot for after your first shot, you have 21 days for the Pfizer or 28 days for the Moderna to be eligible for the second shot. Some individuals have passed that date and still have not come in to get the second shot. So please, if you are one of those people who've had the first shot but have not gotten your second shot, we urge you, come out, get vaccinated, get protected. Next slide. This is the pie chart looking at the total coverage for our population. If we look at everyone who lives here, according to the U.S. Census 2020 count, there's about 49,710 people here in American Samoa. So among those individuals, 80.7%, that's what we're estimating to be fully vaccinated. However, about 6.1%, if you do the math, there's anywhere from 3,000 to 4,000 people are eligible for the vaccine, but still have not come in to get that first shot. That 8.6% in the pink looking area are among those, among the children less than 5 years old who are ineligible for the shot. 2.5%, that's the people that are past due for the vaccine need to come in and get the second shot. 85.3% of the total population with at least one shot at this time. Next slide. And this here is the map looking at the coverage of our vaccination, those who are fully vaccinated by village. And what I wanted to mention here also is that the spread or number of people coming in to get tested, it's almost mirroring what we're seeing here with this coverage map. Far right side or the east side of the island, majority of those villages are in the light blue color spectrum or the dark blue color spectrum. The dark blue means that you're 90% and over. The light blue is 75% to about 89%. The green or light green area there, 60 to 74%. So if you notice that where the cases are coming from are in that area, those high population areas where we have the light green and the light blue color spectrum. Next slide. This is our inventory for vaccines. We have, we're counting about 18,432 doses here on island. I want to say thank you. Thank you to the FEMA team that arrived. They hand carried 2,700 doses that made our drive-through operation possible this past weekend. Also, we received 12,900 doses from CDC this past weekend, bringing that total number of Pfizer for the adults to 14,742. We have a lot of support coming from our federal partners. So please, I urge you in the community, once again, if you are symptomatic, come out to one of our clinics, get tested, and assessed for treatment. If you are due for the booster, please come out. We have enough vaccines. Come and get your booster shot. And even if you are due for the second shot, come out, get your vaccine. And if you're still on the fence about getting the shot and you have not received the shot yet, now is the time to do it. We have the virus spreading in our territory, and one of the ways that you can reduce your risk of severe disease or even death is to get vaccinated. Next slide. I'll stop there. The next few slides are just inventory that's used for planning. I'll yield my time back to the Director of Health. Thank you so much.
Thank you, Dr. Philly. At this time, we would like to turn over to Dr. Fiona for an update for our 10th of March flight coming in this week. Dr. Fiona. We have a document, Dr. Fiona.
Hello, and good morning, America Samoa. I will be providing a brief update for the Hawaiian Airline flight. This flight is scheduled to arrive as planned for March 10th, which is this Thursday. We are expecting a full flight. All travelers will follow the same requirements, such as registering on the Talofa Pass 21 days out. A new change compared to our previous policy is that all travelers are now only required to complete a total of 2 tests. The first test or day 5 test can be done in any state or wherever you are registering from. The second test is required to be done in Hawaii. This second test is to be done 48 hours before the flight arrives, so that means that since our flight is coming this Thursday, this second test should be done tomorrow in Hawaii. You are to be fully vaccinated if you are 5 years or older. Booster shots, even though it is not currently mandated, we highly recommend you get it, especially now that we have COVID spread in our community. We believe that booster shots further reduces your chances of developing serious COVID-19 illness, its complications, hospitalization, and preventing death, especially since our population have a lot of medical problems, such as diabetes, hypertension, asthma, heart failure, obesity, smoking, and so forth. We will be using 3 quarantine sites, namely Sadis by the Sea, Fatuainga, and our newly opened airport quarantine facility. We do not have the full availability of the Tradewinds Hotel. Therefore, if you are a single traveler and know of other family members coming with you on this flight, please go ahead and make arrangements to share a room with them here. This important information can be sent directly to the medical team here in American Samoa or on the ground there with our American Samoa DOH team in Hawaii. Upon arrival, all procedures as previous flights will remain the same. Quarantine duration for this flight is now only 72 hours or 3 days. There will only be 1 test done here, and that is on your 3rd day of arrival, which is Sunday of March 13th. All travelers that test negative will be released to go home on home quarantine for additional 7 days. If a new positive person is identified from this test, that individual will be assessed by the quarantine physician. the physician will determine if this individual would need to be given our COVID-19 medications that we have available on island for treatment of any of our positive symptomatic COVID-19 cases before being discharged to home isolation and follow up with our EpiNet team. Thank you very much for your time, our fellow viewers. I yield my time back to our Director of Health.
Thank you all for our call. We'll stand by for questioning after everyone's provided their briefing over.
Thank you, Director Motusa. Now we'll move on to LBJ's briefing. LBJ, this is your opportunity to brief, or to brief.
Alofa lava, good morning, America Samoa. This is a briefing from LBJ Tropical Medical Center, your only hospital on island. Our priorities here at LBJ Medical Center is to provide healthcare services to the people of American Samoa to prevent the spread and impact of COVID-19. And we do that by working together in collaboration with our stakeholders, the Department of Health, the American Samoa government, and the federal stakeholders to support our unified operational objectives to provide that healthcare services to you. And our third priority is to identify, and we do this by screening and testing everyone that comes to LBJ Medical Center. We evaluate you. If you are positive or if you are negative, we do further investigation if need be, and we do manage you if we find out that you are positive for COVID-19. We do that so that we can prevent any deaths and to minimize anybody from becoming more sick with COVID-19. What we are doing right now, LBJ Medical Center have our Code Red policy that we are using for outpatient and inpatient care. We are opening our outpatient clinic for scheduled patients only. So patients that are called in to be seen, or for those patients that we feel it is important that you be seen in our outpatient clinic, we will contact you and coordinate your care here at LBJ Medical Center. As I said before, everyone that comes to be seen in our outpatient clinic, they will all be screened to make sure that you are negative before you are allowed into be seen in the clinic. And if you are positive, you will be managed accordingly. And for all those that requires inpatient admission, they go from the emergency room. They are admitted first to our quarantine COVID tent while waiting to be seen and be evaluated by the physician of the respective services that will see you and will attend to you. And if you are determined to be admitted to the hospital, you will be admitted to the COVID ward in the hospital, and that is where you will be taken care of. We try to make sure that this information for outpatient clinics and for our inpatient care is disseminated to all levels of hospital operation so that everyone that works in the hospital will know and understand this policy so that we can allow a smooth workflow for our patients who are coming in to visit our hospitals. As of today, we have already conducted 2,151 tests, and out of that 2,151 tests, we have 58 positive cases. This is as of the last reporting period yesterday at 7 p.m. So out of those positive cases, we have treated 21 patients. And those are the treatment that has been given. We have 12 patients that were given oral medication, and we have the 9 patients that were given the IV medications. We had 17 patients that were treated as outpatients, and they were sent home, and they were given our Department of Health outpatient advisory of isolation at home. At this time, we have 4 patients who are admitted to our COVID ward, and these were our first patients who were admitted because of COVID-related illnesses. All these 4 patients, their details are: 1 admitted on Friday afternoon was a 37-year-old female. The patient was fully immunized and he presented with COVID symptoms. She was the first admission on Friday afternoon. And on Friday night, we had an 82-year-old male who was non-vaccinated. He was also presented with COVID symptoms. And after meeting the criteria of admission to hospital, he was admitted and is being taken care of. Our third patient is a 102-year-old male who presented in the early hours of Saturday morning. After meeting our criteria of admission, he was admitted to the COVID ward. He is also not vaccinated. And our last patient, our last admission, was on Saturday late morning, and this was a 63-year-old female who was also not vaccinated. He was seen with COVID symptoms, and after meeting the criteria for admission, she was admitted to the COVID ward. So as of today, we have 4 admissions to our COVID ward. 3 of these patients are not vaccinated, and 1 is fully vaccinated. And I'm happy to report this morning that all these 4 patients who are admitted, they are well, they are doing well, and they are fine. They are only receiving oxygen intermittently if need be, but otherwise they are well and stable. And we are looking forward to discharge them from the COVID ward, to move them to the general ward in an isolation room for a few days. And if they are tested negative, then they will be discharged home when they are stable, to be followed up by our Department of Health. We had 2 laboring mothers who were admitted prior to these 4 patients. Those 2 admissions, they were because of their other medical problems, but because they were in labor and not because of their COVID status. But we admitted them to the COVID ward because they were positive of COVID-19. I'm happy to report that these 2 mothers were both discharged, and they are both being followed up by the Department of Health, and they are in good health. Up until today, we don't have any COVID-related death. Our ongoing task right now, we are continuing to evaluate our operation at LBJ. This is something that is new to our island and to our medical community. So we are identifying gaps, and we are making amendments to our operation policy so that we can improve on what we do and make sure that we take care of the health of our people in a smooth and in a professional manner. Some of the urgent needs that we have right now are our staffing. I would say that as of today, we have adequate staff to take care of our patients, both as an outpatient and also for our patients who are admitted in the hospital. Today, we will be having our first team from our federal partners and FEMA, who will be joining us in the hospital to help us out in our COVID quarantine tent for our outpatient treatment. And we are so grateful and thankful to our federal partners who are able to provide us with this timely assistance, who will be start working with us from today. Now, I'd also like to thank our federal partners who will be providing medical support for us from the 14th of March, providing us with necessary critical care nurses and critical care physicians to help us and prepare us if we have a surge in our COVID-19 in the next couple of days. It is very important that this information is disseminated to all of our public viewers and those who are listening in this morning's presentation, for you to know that we are doing our best here at LBJ Hospital to take care of your needs and to make sure that we minimize the risk of people from getting more sick. And for those that are sick and admitted to the hospital, we're trying to make sure that we are preventing people from dying from the effect of COVID-19. Our outcome, desired outcome, we are grateful that our federal partners are here, our Army Corps of Engineers. We have already had a meeting with them on Saturday, and they have reviewed the infrastructure that we have to make sure that we are well prepared if there is going to be any COVID surge. And today, they are going to be here in the hospital. They have already been here to look at work that needs to be done and the recommendation, and they will provide us with that assistance in setting up our infrastructure so that we can be better prepared to take care of our patients. As I said, we have already got a process in place that is working smoothly right now to make sure that patients are taken care of. The resources that we have adequate supplies, and we have adequate staff right now to take care of what we need right now. And we are so thankful that we will be having additional support resources in terms of staffing that will be provided to us by FEMA and our federal partners. I'd like to mention here again that this is our desired outcome here at LBJ Medical Center, is to prevent anybody to die from COVID-19 and to reduce the risk of people getting more sick from the effect of COVID-19. Thank you very much for listening in this morning. Thank
you, Dr. Ladua and LBJ, for the presentation today. Appreciate all the work that you folks are doing there. Same thing with DOH, Dr. Zaifili, Dr. Lavau, and Dr. Fiona, and of course, Director Motusa. Thank you all for the great work that you are doing to keep us safe. And now I'd like to turn the time over to our Attorney General Fainu Lele, and he will just give a summary of the changes, modifications of our Code Red as we move forward starting tomorrow.
Patulong fatalo fatu ile swafa manu malo ultato wali multato faolo Yesu Kiriso nei foi vai tau le leni malu ultato watunu e on sau no la fionga ile kovana ile nei tai au mo fawa wina le failo mumu mo le isi fituaso fa wai le failo mumu po le Code Red mai ya mati la sovalu fangata mai ya mati la sosfuma lima ya waya inga masani lava ayenyo na teuteunga mo nei foi vayaso ole tulanga il fasaina o potpotonga I no fuanga mo tangata lautele ya olo tu maupea ayai na yona teuteunga I fuafuanga taua malemana o mia al tatou malo male tunu. Ia il fa moe le nei vai yaso o la tutu faina ai pepa tau mafa mo whana wa onga il mtanga luenga wa onga. Lona winga ia to telefo ile malo le tunu o le a wai. Ai o lo fatu mawina ia le tatou tu la fono po le a inga. E ono futu le vā o leisi tangata mai leisi tangata ia whaatasi ei foi ia matalifonga po o face mask. O fea lava o nofuanga lautele iai ia le mamalu o le tatou atunuu po tonu o fale mawhaio na ulu fale ai tangata lautele po se nofuanga I fafo. E tau pea o na ustaia lea tulafono e ono futu le wā ia matalifonga po o face mask. Ia o nei foi vai aso lo fuafua e tufai pepe tau mafa le DHSS. O tele foi le malo la tunu no fuanga pe o tulei. Ia o le atufai ia pepe tau mafa fa mole mole. Ia tau tuana ia le ono futu le vao le istangata mai le istangata. Ia fa pe foi matato talifonga. O loo Iai pea le finangalo o le fionga kovana ma lutena kovana ia tanga I tutoa I se talsanga mai al company o le Starkiss ia awa ia to e whauawina o lato ngā luenga ia mau te iloa le whaingo fie fo I lea whaiunga ai ua talanoa I le fionga whaatonu ia motsa whape fo I le mtanga luenga o soifua maloloina. Pea foi a tatou paanga mai le malo tele, ia I le FEMA ma le CDC, ia fautua ia awa ia fuafuanga. Ai a whai talaina ia le tatou Starkiss, ia tele lava ia meo restrictions. Tangata uma whai ngā luenga, tau ona fully vaccinated, ia mamaua lato booster shots. O tonu I o fea lava o le company o le awha iai ngā luenga meise ia le vaenga le safua le ia tau na face mask malava ia tangata ia whapea foi ma social distance ono futu I le vao le istangata whai ngā luenga mai le istangata whai ngā luenga. Ia whaia foi suenga masani o le testing I sue aipe maua le tangata I COVID. Then ngata foi lea o sanitizers ma disinfectants ia maisi lava ia inga. O lo wha malusia foi le tau sisi a la tau ia tu la fono al malo tele iei le OSHA o le Occupational Safety Health Administration. Ia ina ia saunga le mu ma manuia ia le soifua o tangata whai ngā luenga. Ia whapea foi le tatou watunu. Ia ma o iai foi malea ia inga. So se taimi lava, e fina ngalo ai le malo, pe a tanga iwa iei se mea wa le saunga le mu. Ia mo tangata whai ngā luenga whape fo I le atunu. Ia e mwhai ona tau fia ai a ngā luenga I tonu o le company o le Starkiss. Ia o se taimi o le neiva I aso, o le a fuafua e whai ai lea whai unga. Ia ma whauau ai ngā luenga wā toa le lua vai aso. Ia talu ona tau fia ia ngā luenga le company tele o le Starkiss. Nā usau no atu sui po se sungan fo mai I tatou pāsese po pālele lau pāsese o lo o whaasaina pēa ia malanga mai fafo ia au mai aini pāsese ia wānganā ia le waalele lean sawai au malanga le FEMA o na mana o mia ia whapea foi ia le tatou Hawaiian air flight mo neiva yaso I le aso tofi ia le aso sfulu o mati ia ma le tatou malanga leo mai ei nei fo mai e sosoani si o tatou atunu I le aso ngafua o le asau le aso sfulu fa o mati. E tā ua lava le ngā lue whaatasi o le tatou atunu. A mata mai ai inga I a inga. Tau ana self-quarantine. Pea ana whai atu stemi o sola. Ia tau lava ona tam whai a inga awan so na o I fafo. Panganani mana onga tā ua. O leo e whai e tui pui puia. O leo e whai e suenga o le COVID pe a naumia. O leo e whai ia whataunga o tau mafa. Ia po leo fo I le whalemai. Ia o mana o ngā tāua nā ia e mawhai e ona o I fafo. O fo I le so ona o I lunga o le awal tele ma le tumu solo ai o le tātou awal tele. O tātou pisinisi, ia mo le taimi nei, ia o le 5 i le vaveao e tau le 4 i le vavea i le afiafi o i tūlā lina e mwhai ona talaina ia pisinisi. A tonu i se aso o iluma, ia po le nei fo i vai aso, ia o iai le manatu, ia pe whaopopo na i tūlā, ina bawhai ona tala ia tātou pisinisi mo le malu o le tātou atunuu. O whaleainga, ia whapea fo i mapā ma mea whapea nā, ia e sā ona whatanga ni tau mawhatanga i tonu o whaleainga. Ia ai bawhai ona whai le mele tau o le pick up, o le take out, ia po le delivery fo i ia o tau mafa. Tau o fo i le silifia tātou pisinisi, o alava pisinisi o lo tala, e nao tangata mana o mia lava e tau na whai ngāluenga i mea o lo iai i a ngāluenga. Ia awane i so ona o mai tonu i a tangata whai ngāluenga, i le nei fo i vai tau o le code red. Ia e o fo i tātou ofisa o le mālo, moni o lo iai lava ofisa o lo tau mwhai e whai a lato tau tua, ia ai am whai ona whai i se tūlanga remote, wha ngā aile interneti, ia whapea foi, ia telefoni, ia ma computer, ia e tā ua lea au nanga. O le tātou sā, ia o lo o whaia pēr le wawao masani, mai le iwa i le pō e tau le afo le wha i le waweao. Ma o lea sā, ia e whaasa i ona i ei seisi e so na whea lua i whafo ma lato maota ma lawa, ia whapea foi ia leo i lungo le awal tele al tātou mālo. E nā o tangata lava o iai pisinisi mga luenga mana o mia, al mālo ma pisinisi, e ma whai ona iai i lungo le awala ma whafo lato maota ma lawa i teimi lea. E iai se teimi o luma i le neiva i aso, ia o le a whai aini nei teuteunga i le tātou polo inga le fionga Kovansili, whalawalawe whafuasei, ia a wai ta upu tau soi fuamalo ina. Ina i mwhai ona whaopopo ia pe ona whai atu i tū la o e tala ai pisinisi, ia whapea fo i mai tu ainga pisinisi o tātou gas stations, ia po public transportation. O leis foi mea tā ua o tūlanga leo le whangota. E ma whai lava e tangata o na o e whangota mō lātou ainga. Ina ia tausi ai o lātou ainga. Ia e tau o na whauau le nā tūlanga. Ia po le tangai fo i tuai o tātou e tua fo i le vau i meo whatuanga me tūlanga whapena. Ia e ma whai o na ngalueina ia lau whatuanga. Ia, o nisi nao o tōtonga o le tātou whailo le tūlanga mumu i le nei waitaimi ia ma le ngang whaaloalo whaftai.
Whaftai lawa fionga i le loia sili, ia mo le o tōtonga fo i o swinga o le awhai, ma le whaamala malamaina o tūlanga o le tātou code red. Well, that was, thank you, Attorney General, for a presentation on modifications of Code Red. As we continue, as the governor has announced, Code Red will continue through March 15th. This version of Code Red will be modified to release some of the restrictions and allow more movement in our communities so that we can access the people who need services to get the medication and to get vaccinated. So thank you, Attorney General. This time, I'd like to turn over to our federal partners, to FEMA, for their presentation today. I think we have Allison Flander Allison, this is your opportunity.
Ms. Allison, go ahead.
Hello, Governor, Lieutenant Governor, Congresswoman Amata, and the governors and the public have worked hard for the last 2 years to keep safe. Your efforts have made a big difference, saving lives and avoiding. The Omicron variant of COVID has impacted much of the world. Just COVID-19 has adapted to Omicron, so we have to adapt. FEMA and the federal partners are ready to support the American Samoa government-led efforts in response to Omicron. The ways in which we are looking to support American governments are the following. FEMA and the federal partners have 3 lines of effort. This includes the vaccination expansion, the expansion of the monoclonal antibody and antiviral treatment expansion, and the review and expansion of LBJ hospital capabilities. The medical response of 20 PHS public health service, including nurses, will support the vaccination and antibodies mission. HHS is also sending more vaccines and more treatment products to support this mission. We have CDC epidemiologists here who will be supporting the development of the overall COVID-19 response plan and with the American Samoa government. And finally, we have the U.S. Army Corps of Engineers here who are developing options for hospital expansion at the LBJ hospital. This is truly a whole community effort between the American Samoa government, community leaders, the federal family, private sector, including the media here who is supporting us today, and the public. We are all here to respond and to COVID-19 and this Omicron variant. The federal family looks forward to supporting American Samoa. Thank you for your time.
Thank you, Allison, for the presentation and the summary of our federal partners' efforts here in American Samoa. And with that, I would like to open the opportunity to our media partners for your questions.
E talo whalawai lau whionga I le Lieutenant Komana o Monica lea mai le KHJ whamalo tulawa ia autou. O lena o whalonglongo atu I le saunoanga le whionga le Komana o saunoa po whea lea lofa. Ai me se ia I lātou e le o mana o whainia lātou tui. I le taimi le nei, o le alfofonga le mitanga luenga o soifo maloloina ia lātou ia e test positive pe au atu I tautu winga. Ia ona se awala foi le fa malu se ila te ula ia le o ia tui pui e mubuso e faila tui pui e failo le taimi le na o le ana fa amala mai le sunga le fo mai I se sia mato le poti le tulanga e tu ula vel tangata ai pe o le ase fo fuanga le to committee le nei taimi le tulanga le na ona me se lava mol pui nga o tatou fana witi fa mol la ofiong.
Whawhatai mo le sili, o le atu le wanoa I ali fo mai, se suia fo mai mo le se sosoani le sili lea.
Ya, whakatai mo le anoa, whakatai mo le sili. Ya, ai se tau whai atu le sili lea tu sai po I ma tangata I hape test positive, ai watu e whai ala tu tuinga. Ya, temi nei ilo whautua ina le tanga luenga, a whai se isi ua test positive. Ya, e te tau lava o na mulmulta I pea I le pasal langa le COVID, whai le home isolation. Ya, mo stufa aso. Ya, e le te tau fo'i o na watu I o mele ia testing site, se longa lava wa umale is full fast, so they were 2 minutes for Maile, for release from isolation. Yeah, on a from failure on what it's sites of terminate.
Kamolmole lava lau fionga I feel. No, I was asking about what do you do to those who have tested positive but have not been vaccinated? The Department of Health, do you force them to be vaccinated? Or what's the policy?
Yeah, sorry, well, Miss Yatule final silly. For those individuals who are who tested positive and are unvaccinated, they are part of our lists that our EpiNet teams are calling every day. So that's what we're doing. We call and we assess and make sure that they're doing well. If anybody has symptoms that has progressed in such a way that our physician thinks that they need to come in, then we'll send over a vehicle to bring them into one of our clinics to be assessed for treatment. That's what we're doing right now. I also tell if I malusia if I got to it. Yeah, ele o yes malusia o manei patay.
Kamolmole lava la ola le variants le watato yai le mawa ai le to tele tato tangata wa mawa se fa maninga o le ato nu le variants le usa solo nei.
Yeah, first time we'll see sa send your samples here sa test positive mo Hawaii. If I may go donga, yeah, terminate. Lo fa tali pea se fai unga mai Hawaii. Ya o le tala mai le lapa Hawaii. Ya misalo e fitu ana i le school waso business days. E mana o mia la tau e fai ele le running on sample wai. E tele lava ia sample so lo ta fai la tau e fai le genomic sequencing. Ya o se te manatu misalo se aso vai aso nei. E mau mai se tala mai pafu. Ai talu wai o Amerika. Terminei que lá está se lá você vê lá tô ia o test positive mas what would lá ia lá tô samples e fai ele merita o genomic sequencing lá está se lá você vê o lá tô ya o Omicron variant le wa fi ya tal wai lá melia le masa salo fu tanga vela o Omicron variant o le o mai ya ta tô e o tali sim.
Just one more question, please, and this relates to any arrests made and what are the most common violations of the emergency declaration and code red have public safety reported. Thank you.
O le olo tatu whātasi ma le whionga le malo Major Tongia pe sa o ia lau vai. In whaiona mo masif sosani le fsili a le tinai a Monica. Wa yeini tangata, to fien tangata wa loka e tātou ono le tausi o le polo inga o le COVID.
Major, can you hear us? Major Tongia, can you hear?
Yeah.
Go ahead.
Unmute yourself.
So Noah, Major.
Ya malo le seifua ka o muye lau soga le ko banga lukenga ma le malo le fonkanga yo sa u so aku ngai ka au ia e ko lua ia ngaka wa uma o nga rest ia wa fai foi ia le investigation le foi wa mai o nga prepare li poki ia fa alu lungo le official le o le lo ia fai isla ko fa ko ngai ulanga fa msonga ai ko lua mo so si le fia
Yeah, o le aso tu la fono masalomia ai fa molmole.
Ia o le usta ia lea o le tulanga lea wa talaina ia pisingiti ia o la wa mai o na oto kui kongor kako ko rate peila meio non-essential business. O le tūlanga la lea o mafuai ona arrest ia tangata nei.
Hi, Lieutenant Governor Freely with Samoa News, Famulmole Lava. I have a question. Regarding this quarantine for the March 10th flight, why did the task force decide to reduce the quarantine days? Are we concerned with the surge here on island and there's some sort of problem coming up? Is it safe to reduce the number of quarantine days for the flight from Honolulu? And also any update, please, on the flight last week from Apia, the last one with 40 passengers or so?
I'd like to give the opportunity to Dr. Fiona to speak on the quarantine requirements for the Honolulu flight. And then I will try to answer the question about, and then perhaps she can answer the question about the Apia flights as well.
For the question, for the Apia flight, we did receive 40 travelers, and those travelers were tested upon arrival, and they all tested negative. So those travelers, after their test, were being released to go home. For the March 10th flight, as we all know that these travelers have all been tested twice in Hawaii. We also know that there is community spread. The focus of the task force is to help us live safely with COVID. Having them tested 3 days after arrival allows us to assess if any of them has the virus with them. However, all these travelers will be directed to home quarantine. So they are expected to stay at home for the next 7 days. These travelers, there'll also be penalty and fines for those who breach these home quarantine directive. So we are looking forward to the support of these travelers. They have learned to live with COVID off island. Most of them have been doing their best to keep themselves safe, and we believe that they're here also. They will help us support our community and our people in trying to minimize their risk of catching COVID out there in the community. Thank you.
Thank you, Dr. Fiona. One last question, please. There's a report for DOH. There's a report coming out of Apia of a vessel that arrived here in Pango, and the crew members, 6 of them, were tested positive here. Would you be able to share any information? I know the policy is to keep them on board their vessel. Is there any information you can share at this time?
All right, thank you for the opportunity. I'll go ahead and answer that question. Yes, there was a vessel that arrived, and according to our policy, before anything happens at the port, the crew are going to be tested, and if they test positive, they will be staying inside their cabins while our local stevedores are up there to do the work. But when the ship arrived, actually 4 tested positive. The ship originated from California and went through its normal route for the freight, which came down to Tahiti. I think it went to Fiji before coming here to Samoa. They were in Samoa for about 3 days before making the journey here. When we tested the crew member, 4 of them got tested positive. We did give a report to the government of Samoa to let them know of the current situation so that they can do their investigation at their ports to see if these individuals actually left the boat and go into the community. From what we understand is that at Samoa too, they're following the same policy that we have here. The crew members on the boat do not come off. It's only the local stevedores that go up and that do their the work for offloading and uploading the containers. Did that answer the question, Phoebe?
Okay, thank you very much, Doctor. Thank you, Lieutenant Governor.
KVZK?
Yes, Talofa, Malolo Soifoi, Lawafionga, Lieutenant Governor, and also members of the committee. We do have a few questions. Two of these questions came from members of the public who are watching this live, and I hope you don't mind me relaying these to the committee. The first question is, why can't we have churches that enforce 6 feet distancing or allow our children to go back to school if Starcase is operating? What is the difference? That is the question number one. The question number two, and this is again from another member of the public, is whether we are still going to require travelers from the mainland USA to be in Honolulu for 5 days now, especially that the state of Hawaii has eliminated the need for their Safe Travel Hawaii program. Anyone can go to Hawaii whether you're vaccinated or not, so the risk of exposure is the same in Hawaii as in any other US state. So those are the two questions from members of our public. I have another two that I will direct to perhaps to FEMA and IFILI after that.
Thank you, KV. Thank you, Tosi. The issue of churches is still under consideration, and in due course, we will come out with a policy for churches. For the time being, we will keep those the way it is. There is a way for us to conduct our services via Zoom and on the lives, but there's no way for the fish cleaners to clean their fish on a live or on Zoom, so they have to be there in person. But the Attorney General and the legal team will be working closely with our medical experts to devise a plan that will allow our churches to have full services. The Hawaii situation has already been addressed by Dr. Fiona. We are no longer requiring people to come to Hawaii 5 days before the flight. They just need to be there 48 hours before the flight to take the second test. Okay, go ahead and ask your second question, your third and fourth questions.
Thank you, Lieutenant Governor. Perhaps I would like to hear from members of the FEMA who are with us, Allison. We have, according to the presentation by Dr. Ifili Tufa this morning, there's about 6.1% of our population who's still not vaccinated. So my question is, I believe, and I really want to hear your views on this, because I believe the argument that some of these people have been saying all along is the issue of natural immunity versus the COVID vaccine. My question is, why is still a push for the vaccine? I mean, advice that you can give to those who are still arguing that there's no need for the vaccine when you've got the natural immunity. So I really want to hear from you, what advice can you give to the 6.1% of our population who have not received the vaccination because of that? And also, if we can't get everyone vaccinated, what do you think we should do next?
Absolutely. Thank you so much for that question. As I am not a medical professional, I would like to pass this question over to our CDC epidemiologist, Dr. Thane Hancock and Dr. Dick Brostrom.
Hi, thank you. I hope that my internet is coming through all right. So I'm Dr. Thane Hancock with U.S. Centers for Disease Control, and yeah, the issue of vaccinations. One is Omicron has certainly changed the use of vaccinations. The vaccinations are still incredibly important to prevent severe disease, hospitalization, and death, and especially getting that booster is really important. When people worry about natural selection or natural immunity that they may have that would protect them from the virus. Unfortunately, in American Samoa, really, no one has natural immunity until just a few weeks ago. By not having natural immunity, you really need to get the vaccination to be able to boost your immunity so that if you do get Omicron, you do not get severe illness. If we are unable to vaccinate everyone, that's okay. The people that we really, really need to get vaccinated and boosted to protect against Omicron is anyone who is older. I would say even if you're over the age of 40, you absolutely need to get vaccinated and get boosted to protect yourself from severe illness and death. And for somebody with comorbidities, such as diabetes, overweight, obesity, those are other high risk factors for developing severe disease that the vaccine really does help protect against. That's what we would encourage. Again, Omicron has sort of changed the dynamic. If you are vaccinated and boosted, you can get infected with the virus. So that's something important to keep in mind. But being vaccinated and boosted reduces your risk of developing severe disease, hospitalization by 97 times. So it's very important that the American Samoan community go out, get those boosters, especially if you're high risk. I'm going to stop and just pass it over to my colleague, Dr. Brostrom, who may be on if you have any additional comments before wrapping up.
And thanks, Dr. Hancock. And I hope the connection and the sound is okay. I just wanted to refer back to Dr. Ifili's slides, which really demonstrate what Dr. Hancock was saying. Unfortunately, the vaccine with Omicron will probably not protect you from getting the virus. I think where that vaccine is so valuable is it keeps you from having to go to the hospital. It keeps you for having a minor cold, sore throat, but it doesn't go beyond that, particularly for those who are boosted. So when you saw Dr. Ifili's slides in American Samoa, you see that there's a lot of folks who were boosted but mostly folks who even got 2 shots and they still are testing positive. That's actually okay. From our perspective, we expect that. But when we see the slides from LBJ, it's a different picture, and we see so many people who were unvaccinated or who did not get a booster. And unfortunately, so far, they're the ones that are going to the hospital. So the best way to stay out of that hospital is to get your booster, especially for those who are over 40. Thanks.
Doctor, I have another question very quickly, please. Part of that question was if we cannot get everyone vaccinated as you advise, if we can't get them to do what you're telling us to do, what do you think should be the next thing to do for this 6.1%? I'm interested to know what your advice would be, please.
Well, there probably is no jurisdiction that can achieve 100%, and your numbers are as high as anywhere in the world, at well over 80% for a vaccination. So it's probably not realistic to imagine 100% fully vaccinated, but still we try. And you saw the amazing work over the weekend with over 1,200 boosters given on one day alone. So for those who are not vaccinated, if they are, most of them may be children, and that is still something they should try to get the vaccine. But the healthcare priority, the priority here is to protect the hospital and protect individual healthcare, and that's for the folks who are over age 40, as Dr. Hancock mentioned. And I think if there are people out there who need the vaccine, it's still available, of course. Our teams here are going to help vaccinate, so we should be able to really boost this amazing vaccination effort you already have. On top of that, I think it's important for you not to wait for public health, but to call, and they're putting together teams to go to the home and to vaccinate folks who can't get out in the home, so that we can try to reach a higher number. But we certainly won't be able to vaccinate everybody. And the hospital is prepared as it can be to handle folks who may be sick.
All right, Doctor, thank you very much. Thank you very much, Lieutenant Governor and the committee.
Joey Cummins, KHJ News. A follow-up question for Dr. Fiona regarding the home quarantine for those that are incoming on the March 10th Hawaiian Airlines flight. Can you offer more detail regarding the home quarantine part of the quarantine? Does that require distancing from others who reside in the same household? And if so, how is home quarantine from others in the household being enforced?
Thank you very much for the question. For all the travelers that are coming in, we get to spend 3 days with them and get all this information. And we educate them on what home quarantine entails. And ideally, you would want them to be isolated in their own room with their own amenities, utilities, and all that. We found out that not all houses are able to provide that, but at least family members and relatives who are aware that these individuals will be going into home quarantine, they have that family support to be able to provide them with the needs that they will require for the next 7 days while they're in home quarantine. And all of these travelers will be given directives. They will sign an agreement that they do abide and they will follow the requirements, including social distancing, washing their hand, masking, while they're on home quarantine. And as we mentioned, there are fines and penalties that will be enforced for those who don't follow it. We do have our Talofa Pass, where travelers will be checking in on a daily basis on those 7 days. Anyone who's at home who feels symptomatic or sick, this is immediately alerted to us. We will follow them up with a phone call, or a team will come over and visit them at their homes, at their site. Thank you.
John Rayner has a few
Thank you very
questions.
much. Can the task force also offer more
Chloe?
explanation? Yes.
There's 3 of you from your station. So now John Rayner wants to ask a question too. Why don't you go ahead and finish your question first?
Thank you. Regarding reduced business hours, is it said that the measure is in place to slow the spread of the virus? The concern most often expressed is that the spread could be increased during reduced business hours because people are funneled into stores at the same time. Can you speak to this?
Thank you for the question. That's why we are releasing some of the restrictions on this version of Code Red, is to avoid some of those rush hour people coming in to meet the deadline for when stores close. So we are mindful of the issue, and we are going to be addressing it starting with the next version of Code Red. Are there any other? Okay, I think John Rayner had a question. Go ahead.
LT, that's okay. Thank you, Gar. I'll just yield my time back to you, sir. Joey asked our questions. Appreciate it.
Okay. Are there any other questions from our media partners?
Thank you, Lieutenant Governor. We're good.
No, nothing from KVZK. Thank you, Lieutenant Governor.
Okay, we've come to the
Just
end of
No, it's not a question. It's not a question. It's just a remark and a special request. We appreciate the daily reports. However, we have follow-up questions that are being asked. These are questions being asked by the public because sometimes too little information can create more confusion among the public. So is it possible for the DOH officials to still answer our questions? Because now we have a hard time trying to get any information from them.
Monica, thank you for the question. The press releases are released at in the evening. If you have questions, you can email it and it'll be funneled through the EOC. But email the EOC to Director Samana, TCO, You can email me and we will make sure that we have the answers prepared for you. If your question is not vital and not important, it will not be answered right away. But if it's critical, if an issue that is we fail to address, we will make sure that that it is addressed. The reason why I'm protecting the doctors from media harassment is because I want the doctors in the medical community to focus on the work at hand, and that work is requires them to work 24/7. Please be mindful of that. You are afforded all the opportunities to contact, email, and days like today, when we have our press conference, you have the opportunity to have 3 or 4 members of your station ask many questions until you're all done. And when we're done with this today, you can continue to ask questions, but having you call up Dr. Ifili or some of our doctors who are busy trying to execute our mission really defeats the goal that we're trying to do. So please follow the procedures that we've provided. Contact the TCO, contact me, and we will make sure that answers to your questions are provided. We are now
Thank you.
reached the end of our press conference. Thank all of the participants today, our media partners, as well as our federal partners who are being here today. We've spent a little bit of time today in our press conference, but that is because we had a lot of issues to cover. Moli atu le nganga whaftai, ili mamalu le atunu, umwhaio na maua le avanoa, tātou te mafutai le nei tai au, o le nganga o lau whainga malo, ia matua te pea, ia oto otonga, ma whamatalanga o le tau mwhainga, ina ia tātou nofo mala malama, ma ia tātou I loa tū langa o lo whianga iai le whainga malo ma le whamai. E le aise manatu I le whionga le kovana, ia whapea foi lo mātou nofo nofo atu. E nā tia whatu ala vai se fuafuanga o le tau mwhainga. O le anganga, ia tātia atu fufola whaafala I malai, ina ia o tō sila fia tū langa o le tau mwhainga. E le fisilingia, e iai foi te mi ua le a tō ai le tau mwhainga lau whainga malo. Ia mātou te whapena lava o na whailo atu. Ai mana umia, pe o na saunoa le whionga le kovana, me mana umia pea la o tō sosoani, ma la o tō tapua inga, ina ia tātou ngā lulue whātasi I se awala, e manui ailo tātou atunu. Manu te leina fuafuanga o ngā luenga I le nei aso, ma le nei vai aso. A whape mua foi nisi tala e mana umia e se tātou mafutanga I le nei vai aso, ia o lea whape nā foi o na toi wala a watu se tātou mafutanga whape nei. O awhiawhi taitasi, I le valu, I le awhiawhi, ia o lo tau mwhai lava le awhionga I le TCO, ma le tātou Emergency Operations Center, e matuu watu tusinga o ngā luenga sa whaia I le aso. O le valu le tai au taitasi, e whaia le briefing a le EOC, ia a whapea iaise mata upu e tau ona whailo atu le tātou atu nuu. Ia o le a whapea nā fwoi ona whai. A le nei aso ma le tātou mafutanga, le whio atu le whionga le loia sili, whionga le TCO, ma le mamalu o le atu nuu o lo whafonga mai. Whionga le kovana e whapea fwoi lo tātou sui I le konkeresi. Ia o se whamatalanga le nā le tātou ngā luenga, Rick Samoa, ia lava pale pea ma lava le ona sai, a o tau mwhai tātou te o atu se tūlanga e tātou te whai ai o na ngā lulue, ma mua foi se saolo tonga mai puipuinga wai tātou iai le nei vai tau. So I fua mai manuia le nei aso.